So now I'm showing you something you don't see regularly. This is called cystoscopy. So I'm posterior to the medial head of gastrocnemius. I'm in between middle head of gastrocnemius and semimembranosus. Broken the POTSI, which is posterior transverse synovial infold. I'm back and doing a cystoscopy. Look at all the internal septations within the cyst. All these are called internal septations within the cyst. Okay. So how did I go there? I'll come back and show you. This is the middle head of gastrocnemius. That is semimembranosus. I've erased this tissue posterior transverse synovial infold. I've gone slowly across from the posterior transverse synovial infold, reaching it and going across into the middle head of gastrocnemius, and then went into this cystoscopy. So I can feel the skin. So this is my skin, and I'll show you. I'm palpating the skin. Come here. Show me this. This is my semitendinosus tendon. Right. This is my semitendinosus tendon. This is my hamstring. So right medial to the hamstring. Look at that. So the moment I poke this, go there. The moment I poke this, I'm right at the popliteal fossa, right, medial side, right. So I'm in the safe zone, and I will look at that. All these are cyst bodies, and the muck in the cyst, and all these has been thoroughly decomposed. I'll show you everything again to reiterate everything. This is my ACL, which is quite vascular. So this is my PCL, which is quite vascular. I'm going in between the gap between PCL and the medial femoral condyle, very inflamed kind of a tissue. The moment I go and navigate into this posterior middle portal, this is my posterior middle portal. Look at that. This is right at the bang center, middle head of gastrocnemius. So this is my POTSI tissue. Give me a Weisinger rod. So this is my POTSI tissue that I have debrided. Right. So this is my POTSI tissue. I'll show you again. So this is my POTSI tissue, and that is my middle head of gastrocnemius. I've gone behind the middle head of gastrocnemius because my Baker cyst is always, hold this for me, Mahesh. So the Baker cyst is always behind the middle head of gastrocnemius. The moment I go there and I turn my scope, this is my cystoscopy. Right, this is my cystoscopy. Just like bursoscopy in the shoulder, this is my cystoscopy. Look at that. And now I'm pressing the skin, and I'm right there. Just I'm touching. I'm able to feel my finger. Right, all the cyst has contents have been decompressed. The Baker cyst has been thoroughly addressed, and one-way mechanism has been made into a two-way big hole, so that there is no communication. There is good communication, and all this POTSI tissue has been debrided. And look at that. I'll show you. Look at that. Just hold this for me. Hold this for me. No, now you will see the middle head of gastrocnemius. Look at that. All this is POTSI, which is posterior transverse synovial infold. And once you remove the POTSI, you can remove the entire POTSI. But I'm not removing it. It's not needed. But behind that is what you find, which is middle head of gastrocnemius. And behind the middle head of gastrocnemius, you go and enter the cyst wall. And this is the entire yellow gelatinous tissue in the cyst, which are thoroughly decompressed. And I'm pressing it, and you can see that. Thank you. All this